Good morning, everyone. My name is Naveen. I'm a kidney transplant recipient and a lupus patient. I was diagnosed with lupus in 2020 with a kidney failure, and I was subsequently on dialysis. And I received different kinds of biologics and chemotherapy drugs. And finally, in year 2021, I got my kidney transplant. It's been 4 years into my kidney transplant, and I've been doing quite well. And it's time for me to give back to the society. And hence, with Kidney Warriors Foundation, we have come up with an initiative to conduct master classes on different kidney diseases and different kinds of kidney diseases that can affect your kidneys and that can cause permanent damage or cause different kinds of mental and physical health related problems to the patients. So today we're going to talk about lupus, which is also called systemic lupus erythematosus. And for the first masterclass, we have with us Dr. Anitha. So Dr. Anitha is a nephrologist and a renal specialist with 31 years of experience. She practices at Apollo Hospital, Jayanagar. She's been working with Apollo Hospital for the last 7 years. Dr. Anitha has a special interest in hypertension and kidney disease and is following up with a lot of patients now. She also encounters a lot of lupus patients. So we felt that Dr. Anitha would be the best person to talk about SLE and lupus related kidney disease because not everyone knows that lupus can also cause CKD and also cause permanent damage. Till now we only know that diabetes and hypertension are the major reasons, but there are a lot of other reasons as well, those 10% or those 15%, and lupus is one of those very rare diseases which can affect the kidneys. So without taking much time, I would like to give the stage to Dr. Anitha to say a quick few words, and then we'll start the masterclass. Dr. Anitha, thank you so much for joining this masterclass. First of all, how are you feeling?
Yeah, good. Thanks, Naveen, for that beautiful introduction. Uh, I think I will just discuss a few things about lupus. As you said, I have been seeing lupus patients for a long time, and I have chosen a few questions which frequently I listen from them, and I thought I'll try to clear up some of their doubts, considering the general population and the people who are probably seeing lupus in their life for the first time or going through it. So I thought we'll just have a brief discussion about it.
Perfect, perfect, perfect. So we'll quickly start the question. So to begin with,
Yeah,
doctor,
sure.
what is lupus? What is SLE? How can you explain a normal person who's just gotten diagnosed with this term called SLE, right? When I was diagnosed with SLE, it took me, 3 days to essentially learn or mug up systemic lupus erythematosus. It took me 3 days. So how can you explain what is systemic lupus erythematosus to a common person?
Okay. See, systemic lupus erythematosus is a autoimmune disease. See, normally we have this immunity. It is actually meant for us to fight against the bacteria and other viruses and allergens and other things. That's a normal protective mechanism meant for normal people. But in autoimmune diseases, what happens is the same immunity is fighting against cell. Now, the question is why, what, when does it start? Many of these questions, I think none of us are able to tell. As you said, lupus can come to anybody at any age, and suddenly, sometimes triggered by some infections, sometimes has a genetic background, and some people have even found some environmental factors also. So now it is very difficult for us to either predict or even tell, okay, tomorrow or day after tomorrow, this person is going to get lupus. Only when they come with some symptoms do we know that they are having lupus. So this is actually lupus, something which is normal and natural required turns a enemy for us. So that is lupus.
Okay, thank you so much for explaining that, doctor. So, you also touched upon genetics, right? So, a lot of people ask me, Naveen, is it hereditary? Did I get it from my parents? Was it there in my bloodline for a long time? So, how can we explain this to a common man who is considering that lupus is very complicated, right? So, how can we explain this to people that is it hereditary? Is it genetic? How can we simply explain this to a common person?
Oh. See, many a times we are seeing family members having lupus and the chance increases. Yes, true. Genetic, there are a few genes which are considered to be more related to the lupus. And now we are coming up with the complements and its levels. Is it deficient? Is there autoantibodies against the complements? Is it getting activated and not suppressed? So there are many things which are happening. So it is very difficult for you to pinpoint at one thing and say, yes, this is the cause. And on the contrary, you see that some of them have in the family, but the next generation does not get it. Now, how do you explain the other side of it? So it is very difficult for us to exactly pinpoint, at least at this point of time, it is very difficult for us to say, yes, genetics are there, it was there in your bloodline, and that is the cause for it, and we could have detected it earlier. No, as of now, we don't have that issues as of now. Maybe in future we'll be able to identify some of them, and maybe we'll be able to pinpoint it. As of now, no, it's not possible.
Yes, doctor. Thank you. So, doctor, how common is lupus? Like, is it? It's. I mean, we know that a certain gender gets it, but would love to understand from you how common lupus is. How quickly is it diagnosed? How quickly can you diagnose it? So, yeah, yes, doctor. Would love to understand about that.
Correct. See, lupus is quite common. See, I'll not give it to you as a number in any given population because that is, I know, more in the community medicine we do say that. But remember, it is more common amongst women, much more than the men. Reason? Their immune mechanism is completely different. Okay, so it is more common among women. And having said that, the age group is somewhere around 15 to 45. That is when they are actually having their menstrual cycle. Okay. And males, when they have the lupus, they usually go through a very difficult situation in the sense the progress and the way lupus takes a male patient is completely different from how a lupus is working in female patients. It is different.
Yes, yes, doctor. So, in fact, there's a study that says 9 out of 10 lupus patients are women, and most of them get
True,
diagnosed, as you said, at the time of either childbearing age or they are either juvenile. So, it's a very
true,
cruel disease because it affects the women at the most productive years, and thereby
true,
kind of makes them feel crippled also to some extent. We have
true.
Mohammed at Shah. He's trying to ask questions. So what we'll do is, Mohammed, we'll get back to the questions towards the end. I will also keep a note of all the questions. What you can do is you can type in the questions in the chat box, and we'll be happy to take them once the masterclass ends. So yeah, coming to the gender part, doctor. As a
Correct.
male, I have one question: why is lupus so cruel towards men? I mean, it's very cruel towards women also, but why do men have a very specific kind of manifestation? The kidneys get involved. Why is it that case?
I don't think we have a proper reason for it. But as you said, we always tell, like even in our regular teaching, male lupus is more severe. It has a very rapid course, and the deterioration in most of the organs are faster in men. So, as you said, it can present as an end stage renal disease even without the prior presentations. But let me tell you, among the women also, many of them have faced such rapid progress. Lupus nephritis, will come to it in the near future. We'll discuss it.
Yeah, yeah. Okay, doctor. Doctor, what are the common symptoms of lupus? How can one identify that? I mean, you should not self-diagnose yourself because there's a common trend. I also talk to a lot of patients. Every time there is some, symptoms related to autoimmunity, they'll quickly, say that okay, they have symptoms, right? They have lupus. So, what are the common symptoms that you should watch out for? And who diagnoses lupus, and at what time you should go to the doctor, and which is the best doctor. So yes, if you can just touch upon that, it would be
Yeah,
great.
sure. Uh, as the name says, it is systemic lupus erythematosus. That means it is a systemic disease. And just like how I told you, the autoimmunity can affect any place. And remember, autoimmunity is not one specific thing. It can affect different antigens, which belongs to different organs. And so the manifestations can belong to different organs. Okay, some general symptoms are like just fever, that is a mild grade fever, which is persisting for a long time, not getting better at all. Some people have weight loss, fatigue, some painless oral ulcers, excessive hair fall, joint stiffness, especially early in the morning, which gets better over time. And some people may have just some little swelling of the feet, or uh, some people have more system wise, in the sense it can be related to the uh, behavior, that is seizures or altered behavior, suddenly noticed and gradually which worsens, that is neurological manifestations. Seizures can be there. And from the kidneys, you know that there can be frothy urine. Some people may notice blood in the urine. Some people may just come with reduced urine output, swelling of the feet, breathless, like severe renal failure. And anemia is another thing. So given that it is a systemic disease having varied presentations, people usually go to different doctors. So it can be just because, see, somebody having a mild fever wouldn't know that they have to go to a rheumatologist, isn't it? So they may just go into a general practitioner or even a physician. So even sometimes with these mild symptoms, it gets delayed. See, how would one predict that a minor fever is going to be a lupus in the future? So it unwinds itself over time. And when
Yeah,
you get newer and newer symptoms, you become more clear. Okay, this person has fever and this is going on for a long time and has weight loss and now comes with rashes or comes with more hair fall, has proteinuria. Now it becomes more clearer for you, isn't it? Rather than when he or she is seen for the first time. So we can't blame the person who saw this patient first, because it every fever is not a lupus. But as the
yeah,
symptoms unwinds itself, then the diagnosis becomes clearer, and at that time it is better for the specialist to see. And as I mentioned, it can be seen by a general practitioner, dermatologist because rashes are quite common, and rheumatologist because arthritis and arthralgias, early morning stiffness is common. Sometimes, because of the anemia, irregular periods, obstetrics and gynecologists may also be seeing this patient. And sometimes
yeah.
it is detected in a health checkup, or a urine protein gives us some clue, and they may get referred to a nephrologist. So,
Yes.
seeing the right doctor at the beginning, I don't know if it is possible because it is a systemic disease. But once you start getting
Yeah.
clues, directing them to the correct specialty is very important. And because the symptoms sometimes are vague, the patients may also go to a doctor in a delayed fashion, isn't it? Anemia, okay, this girl is not eating well. Fever, so probably she's tired. Sometimes it becomes to the extent that Is she really trying to avoid work? Is that the reason why she is calling joint pains and fever? So it is, lupus
Yeah,
is a great mimicker. It mimics so many things. It is indeed
yeah,
difficult for patients and the doctors to diagnose it early. And if you get all the
yeah,
symptoms, or at least symptoms from many systems together, it becomes easier. Or when the patient presents with severe renal failure, you know it, the diagnosis is there, it's not a difficult thing at that point of time. But remember, because it is involving so many systems, and because
yeah.
all the patients also may delay it, it gets diagnosed at a later date. It is true.
Yeah, yeah, that's very true, doctor. Beautifully explained. In fact, I would also take, quick 30 seconds to share my experience because, when I was diagnosed in 2020, and I used to get these fevers, So I was a frequent trekker. I would trek a lot, and I was also into half marathons. I was also a runner, right? So every time I would come back from a trek, let's say minus 15 degrees, I would get a fever of 101,
Hmm.
100. I would go to see a doctor, and the doctor wouldn't diagnose anything. And I would always feel that, okay, maybe it's because of my treks, right? And then I think, I think 6 or 8 months before my diagnosis, I started seeing frothy urine. My mother noticed frothy urine.
Hmm.
And 3, 4 months before my diagnosis, I was immensely fatigued. And my father noticed that, and he also said, you should go and see the hospital. Your parents know, right? People, I mean, your loved ones or your caregivers know,
Correct.
because they've seen you, right? But what happens is that when you are sick, or when you're feeling sick, and when you're progressing towards that, something that's very big, you don't realize that, you're being indifferent. And I also kind of delayed my diagnosis because of,
Correct.
I don't know. I just delayed it. That's what I feel. And you just beautifully touched upon a point that lupus is also a great mimicker. And a lot of times I've heard cases wherein a lot of juvenile patients have told me that, Naveen, I've been not understood in my school. A lot of times these kids don't want to go to the morning prayers because sun is like an enemy for lupus patients, right? And a lot of times they are forced to go to the morning prayers, and they avoid sports. And yeah, I think you just beautifully explained the fact that it's a very complicated disease, and it's also a great mimicker, which kind of brings us to the part that where you explain that lupus affects different kinds of organs and tissues. But can you slightly, dig deep into it and explain the kinds of, manifestations that you can expect, and at what stage can you expect, kidney related lupus, doctor? Because there are studies, but I would want to understand from a specialist like you, at what stage does kidney starts, getting involved here?
Okay. See, this, as I told you, this lupus is something that can just be silent for many months to years, or it can present suddenly like a bolt from the blue. You can't actually predict lupus. It is so unpredictable. Even after years and years of experience, we will not be able to say how it is going to progress. So, one is I will just give you a brief about the organs that are involved and what symptoms you get. I think, do you have the slide also in which I have put in the organs
Yes,
that are
yes.
involved, including the mouth ulcers can be there. And remember, these mouth ulcers may be painless. It is not even painful. Okay. Rashes can be seen, especially over the face, in the classical butterfly rash, what we call it. And
Yeah,
photosensitivity, as you said, if somebody goes to the sun, they may start feeling that the skin is getting burnt. Okay, slowly it may look red, and over time it just goes away. And this may go on and on and on, and over time it becomes a scar. And there can be scar like lesions, different varieties. As I told you, it is a great mimicker. It is going to have different lesions. You can't say one lesion or not. And some people will have such lesions on their scalp, and so the hair falls hair fall can be in locks. I mean, you can just pull out and a lock of hair is out. So this can also be there. And as I told you, the other organs can be involved, including the heart, wherein you can just have a palpitation or tiredness. What is presenting like what is very difficult to say in lupus. As I told you, it need not involve all the organs at one go, and it can sequentially involve, and at the end may not involve some organs at all. It need not involve all the organs, need not have all the symptoms for everyone. So, as I told you, this early morning stiffness is another thing which usually people present. Okay, and low grade fever going on and on and on, some weight loss. Some people even think that is an intentional weight loss. Yes, I've been dieting, so my weight loss is there. They will not know. And slowly they change their skin colors sometimes, and
Yeah.
rashes, as I told you. So many things. As I told you, it is very difficult for lupus to be described in a few minutes. It's a varied organ involvement, varied
Yeah.
presentation, a great mimicker. So that is one thing.
Yes, yes, doctor. That's again beautifully explained. Even I had weight loss, and uh, you know, yeah, I just felt like maybe I'm not eating properly, and I would just quickly eat and eat
Correct.
and eat and eat, right? Which kind of brings us to a very important topic, doctor. You have said that you can reach out to cardiologist, you can reach out to dermatologist, you can reach out to a nephrologist, right? All these are essentially doctors who suggest allopathy, right? We have different kinds of treatments. Okay, so can you also touch upon the kind of treatments? And before treatments, I would also want you to touch upon how do we diagnose lupus, right? What are the clinical parameters, if there are any, so that people can also know about it. We have seen a lot of patients. Personally, I have seen a lot of patients, coming up with one certain parameter. I won't name it. I would want you to name it, and saying that, "Hey, Naveen, I have this parameter being positive. I have lupus. What should I do now?" Right. So yes, how can we diagnose? What are the clinical parameters, and also the treatment that you do for lupus?
Yeah, correct. Like you brought in a very important question. As you said, see, this has vague symptoms. So it is easy for many of the people to have some of these symptoms at some point of time, and the reason may be multiple. Say, for example, somebody is recovering from a viral fever, has a vague fatigue, and sometimes some rashes can be there, joint pains can be there. And now, in the time where Google is your friend, it becomes very difficult for the doctor to convince not to self diagnose. As you said, even I have come across people who have just seen some symptoms. Okay, I'm having anemia, I have some joint pain. So they Google and they say, oh, I have lupus. That's not right. You should have a diagnosis from the doctor. And uh, because there are so many overlaps, self diagnosis should be avoided. Please, I think that is one message that I want to give it to the general public. Lupus is difficult to diagnose even by the consultants who have had many years of experience. There are specific criteria when we look at it, and only then we call it lupus. And remember, calling somebody having a lupus is not an easy diagnosis. In the sense, they may have to live with it all their life. So, when I have to call somebody as having lupus, I have to consider 10 times before I give them a diagnosis, because that's going to live with them for their lifetime. So, it's very important for us to diagnose with criteria.
Right, right. So, what are the kind of tests that a doctor would do, doctor, to diagnose lupus along with the clinical symptoms?
Okay. See, there are criteria. I think you put it in the slide. That is, one is the ACR criteria, which has been there for a long time, and they have just slightly modified it, calling it the SLIC criteria. Even here, if you look at it, ACR criteria requires only four out of the 11 criteria that is it has mentioned to call it lupus. And remember, anybody having anemia or some rash, some photosensitivity, even some oral rash. can easily fit into those four criteria. So that's why the SLIC criteria came up saying that just don't consider any four criteria. You should have one clinical and one from the immunological, or at least if you have a tissue diagnosis. Okay, if you have a tissue diagnosis like a biopsy, then you can seriously call it a lupus. Okay, otherwise we should not be calling it. There are blood tests which will look at the complement levels, antiphospholipid levels, and the C3, C4 levels. All these things, when we look at it, and in the presence of the criteria which really fits into lupus, only then we'll call it as lupus. Just because somebody has some four criteria, please do not call it as lupus. Because as I told you, lupus will remain for lifetime. It is like diabetes and hypertension. Probably it can be kept under control, but just labeling it is not right. You have to be very cautious in calling somebody to have lupus.
Yes, that's right. In fact, doctor, can you see this slide that I'm presenting?
No, I think it is not on the screen.
Oh, is it? Okay. I was just presenting this slide all this time, and okay. Uh, it's okay. Okay. I think there's some problem. I was presenting till now the slides. I was just thinking that
Okay.
it's getting presented. Wait, I'll just again try to present it so that we don't miss out on this criteria aspect for sure. Uh, I want to double check it this time. Okay, is my screen visible now?
Your screen is visible, but not the slides.
Not the slides. Okay, I'm
Yeah, now
sharing
I
it,
can
but
see
okay.
the slides. You can probably make it
Okay, okay,
slideshow.
great. Okay, okay.
Yeah,
I also wanted to touch upon one point here. I'll just take 20 seconds for that. So, in
yeah.
my case, when I was diagnosed, my ANA was positive, right? I had low
Hmm.
complement levels, both C3 and C4. My C3 was, I think, 50 or 60, and my C4 was 8, I think so, right? Very low
Oh,
again. And my anti-dsDNA was, if I'm not wrong, equivocal, right? And suddenly I was like, okay, maybe it's not lupus. Is it lupus? It's not lupus. Is it? I was in that confusion. So my doctor, as you said, went ahead with biopsy. Okay, and that's when I got the report and I kind of was diagnosed with lupus, right? So I also wanted to touch upon biopsy, right? Because you do a biopsy when kidneys are involved. So would you like to touch upon the biopsy part, doctor? Like, why is a biopsy required, and
correct.
why it's done? What what
True.
pushes a doctor
I'll
to
just
do a
tell you
biopsy?
about the lupus nephritis itself. See, lupus nephritis is, as I told you, it is a systemic disease, but it need not involve all the organs at for all the patients at all times. So some people will have only lupus nephritis. They may not even have a systemic manifestation at all. So now what is lupus nephritis? Lupus nephritis is when the kidney gets involved. Okay, so what happens in lupus nephritis is kidney as a filter is damaged. So the glomerulus, tubules, and even the blood vessels can be completely involved. So when there is the immune deposits happening, the filter reduces its work. So that is called kidney failure or reducing kidney functions. That is when the GFR comes down, or because the glomerulus as a filter is getting clogged, torn, and then you'll have RBCs or even the protein that is leaking out. Because it leaks out, the tubules are trying to regain all those proteins from the leaked the urine as it is passing, and that will get into the tubulointerstitial system, and there again there will be immune reaction, and there it will go into fibrosis. Remember, kidney, unlike other organs, does not have the ability to regenerate the glomerulus or tubules. They are the uh, end cells. That is, Stem
Yeah.
cells can regenerate. Skin also has some ability to regenerate. Kidneys, heart, and brain do not have the ability to regenerate their working units. In kidney, the working units are nephrons, which include the glomerulus, tubules, and the blood vessels. So, when this is lost, the function is lost, and so there is reduction in the glomerular filtration. There can be proteinuria, and over time, the creatinine starts rising up. So this is actually what is happening in lupus nephritis. Okay, and as I told you, lupus is such a masked thing that you can have people who just have mild proteinuria, but when you do a biopsy, you have a significant lesion, wherein it calls in for a good immunosuppressive medication. On the contrary, somebody may come with an elevated creatinine, significant proteinuria, but when you do the biopsy, the lesions are very minimal. So now,
Yeah.
without
Yeah.
biopsy, how would you predict what is happening inside the kidney, how aggressive a doctor has to be, how much immunosuppression has to be given, and for how long? And also, this when we biopsy, we classify it from class 1 to class 6. Okay, this classification of the lupus is to say, is there only mild lesion, or is there an inflammation which is class 3, class 4, which requires more immunosuppression, and 5, where the proteinuria is much more significant, or class 6, where the damage has already been done. And what is the use of giving an immunosuppressive medication when there is so much of loss already? Uh, for us as nephrologists, the decision is, should I give an immunosuppression when it is not necessary and take the side effects of immunosuppression, versus is the immunosuppression really going to save the kidney and delay the dialysis? So, this question we need to answer, and so the biopsy is mandatory. There are some diseases wherein just the clinical presentation, including diabetes, what happens is, if somebody already has a retinopathy and a neuropathy, we may say no need to do a kidney biopsy because it looks like a diabetic nephropathy. But in lupus, it is not possible to predict from the clinical presentation or even the creatinine, urine routine, your ANA, dsDNA, C3 levels. We'll not be able to say, is it correlating with which class of lupus? And sometimes people do mistake it with stages of kidney function. So the indirectly maybe they are related, but not directly. Let me tell you what is the difference between this. See, stages of kidney functions is more on the GFR and the proteinuria. So when the GFR comes down, the stages of kidney dysfunction goes up. That is, stage 1 has the best GFR, stage 4 and 5 have the least GFR. And that we do call because we want to stage how poor the kidney function is, and when do we initiate them on dialysis. So we can't directly correlate the class and the stages. But having said that, as I told you, class 6 is associated with significant uh, abnormality in the histology, and more likely is it is going to correlate with stage 5. And you can't directly tell them because there is class 6 lupus, it is equal to stage 5 on CKD. That's not true. Okay, so I think people should not get confused between these two things. They are completely different, or sometimes do run parallel. I think a nephrologist should explain each individual patient according to their histological classification and their clinical presentations, and tell them when they need to go for dialysis, because stage 5 and is very close to dialysis.
Yeah,
And
that's right, doctor.
yeah, you just put up that slide. Remember, once somebody has lupus, there's no gender bias for it to land up with lupus nephritis. And Asian populations do have a lot of lupus nephritis for given lupus.
Yeah, that's right, doctor. I think you've beautifully explained. I think you've covered 2 points without even me asking, which is very beautiful. And I want to also reiterate this. A lot of people come and ask me, Naveen, why should we go for biopsy? I think the doctor wants to increase my bills. And I want to be very blunt here. The doctors don't want to increase your bills. The doctor essentially want to decide your course of treatment, right? And hence, biopsy is very, very important. And doctor, as you rightly mentioned, I've seen patients with high creatinine, right? And when we look at the biopsy, right, I might get slightly technical because a lot of people will definitely, watch this video, 1 year, 5 years down the line. So I would want to also get slightly technical here. People coming up with high creatinine, but their disease activity is very low, 7, 8, 6, like that, right? Even 3, 4, and their chronicity is 1 or 2. And I'm surprised because in my case, it was not like that, and I also see patients with very low creatinine, but their disease activity is very high, 11, 12, 13, 14. The chronicity is 5, right? So for a doctor to essentially suggest or decide the course of treatment, it is imperative and it is extremely important. So please, lupus patients, if your doctor is suggesting your biopsy, they don't want to increase the bills. They want to essentially, suggest the treatment. And I would also want you to, doctor, touch upon the treatment and the immunosuppressive medication that you talked about. I would also want you to talk about the different MABs, cyclophosphamide, because again, patients come to me and say, Naveen, why am I put on steroids? Why am I put on cyclophosphamide? My face is swelling. I don't look good now. Why am I put on HCQS, right? So how would you how would you deal with such patients, doctor? How would you first of all empathize and pacify with them, and second, make them understand that the drug that you're giving them is essentially going to a save their life, and b also, yeah, I want you to talk about it, doctor.
Yeah, that's a very good question, Naveen. As you rightly said, this lupus can come only in the systemic manifestation without involvement of the kidneys at all. So, in them, as you rightly pointed out, either a rheumatologist or a dermatologist put them on steroids because steroid is the foundation for the treatment of lupus everywhere. It is an immunity associated disease. So, we want to suppress the immunity which is acting against their own body. So now to suppress it, the best drug in our armamentarium is steroids. Yes, steroids has its side effects, we don't deny that, but it is going to save the skin or organs, whichever is involved, and also delay involvement of other organs if it has not already done. And HCQS is another immune modulator. So that means it slightly changes the immunity, and that's also been found useful in most of the lupus patients. And so it is important for us to use these drugs. And as I told you, lupus nephritis patients will get some general uh, measure, such as lifestyle modification, salt and water restriction, depending on what their stages are and how their creatinine is. And as I told you, a doctor is looking at the patient as a whole, completely, like looking at the blood pressures, having volume overload or not, which are the organs that are involved, what treatment will be best. So there are many questions that are running through a doctor's mind before we prescribe them. So, steroids and HCQS are commonly used. Along with that, we are using the general measures such as salt and water restriction, and dietary modifications, lifestyle modifications. Don't take nephrotoxic drugs so that you can avoid the kidneys from failing. These things we usually tell them. Along with that, to reduce the proteinuria and to prevent the further spinal damage, as I told you, the fibrosis or the scar formation inside the kidney, we will try to slow it down. This also we use some medications. Yes, all of them have their own side effects. We are cautious about it because we are prescribing them for a long, long time. We know them for a long, long time. We are careful about it as we use it for each patient. And very few patients will require immunosuppressive medication, which is a higher dose of steroids. And as you said, cyclophosphamide, which is also another immunosuppressive medication. So these things are used only in certain patients. We are not using it them in all of them. And as I told you, if the damage is severe, and again we will think should I use it or not. Okay, and these are the common drugs that we use as you put it in the slide. The steroids is the foundation, as I told you, very important. Sometimes we use it for a long, long time, even years, I should say, though in reduced doses. So we all know that steroids are associated with side effects, as you said, weight gain, change in the face, stretch marks on the skin, high blood pressures, high sugars for some, acne in some. All these things are there, but we always weigh the risk and benefit and then we prescribe it for the patient. And as I mentioned earlier, some of them will present with a rapid course. In the sense, they come to us with severe renal failure. So then, if the histology is telling that there is some amount of salvageability for the kidneys, then we ask for plasma exchange, wherein we are trying to remove the autoantibodies that are present in large quantities in the blood. We take it out and give the plasma of another person who does not have so many autoantibodies, anticipating that this autoantibodies are not going to fight because they are removed. And so the kidney may try to resolve. And this happens not only in lupus nephritis, and it can happen even in if the lungs are involved, if the brain is involved in a rapid fashion. So there we ask for a plasma exchange. And rituximab is another drug which tries to suppress the B cells. That is one of the armamentarium in our body to fight against the infection. Another thing, as I told you, it is fighting against self. So we are trying to give those medications to reduce their robust and inflammation that is happening inside the body. And there are times when we say no, it is time to give up on the organ and avoid using so much of immunosuppression because the side effects are going to be more riskier than losing the organ and going ahead for a dialysis or a transplant. So then we discuss with the patients and tell them it is time for us to not pursue the immunosuppressive medications and then stop the immunosuppressive medications and look at other options such as dialysis or transplant. So again, usually we involve the patients in the decision making and we will proceed whichever we feel is the most beneficial for them.
Good, doctor. Good. I think beautifully explained. We can talk a lot about lupus. There are a lot of things that we can talk about, but considering the time restriction, I want to touch upon two things, doctor. First, being, can we do Ayurveda? Can we go for alternative treatments with lupus or lupus nephritis? Is it advisable? What are your thoughts?
Uh, Me being in allopathy, I think I'm not the right person to comment and say Ayurveda is good or bad. But having seen so many patients go to alternative form of medications, come back in a bad shape, I would like to say one thing to them: please don't try alternative form of medications. Maybe even if you say Ayurveda has lived for so many years and centuries in India, preventive medicine probably is very good with Ayurveda. I still don't comment about it, but when it comes to lupus and when the kidney is being taken away by lupus, I don't think Ayurveda or any other alternative form of medications will be able to help. as much as allopathy because we are quite aggressive. Like, as I told you, exchanging the plasma, giving heavy immunosuppression, we are doing it. I don't think these are possible with alternative form of medications. Having seen so many patients, my humble request to all the patients will be to avoid going to these Ayurvedic or any other alternative form of medication when it comes to CKD, or even when the lupus is taking away so many organs. Please don't consider that. We have seen patients coming back to us at the verge of life and death. We don't want to see patients at that situation, especially if they have known earlier.
Yes, doctor. Yes, I think you're very kind, and I think you've just very kindly put it out. But for the viewers who will, watch this, in the future, please don't try. It's also my humble request. I have seen, it's a personal story. Like, I was on after my transplant, when my creatinine slightly spiked. I was on biopsy room, and I saw a patient who I met last year with creatinine.
Naveen?
Naveen sir, you are not audible.
Naveen, in between, we could not hear you.
I think there is some issue with Naveen sir's network. Just give us a moment, ma'am. I
Yeah,
am trying
sure.
to connect him. Okay, just give us a moment. Till then, we can touch up the questions our subscribers are asking, like how can I
Yeah,
prevent flare?
sure. Will I be able to see the questions?
Sure. Uh, can you see it in the screen, ma'am?
Oh, wait. I think I'll just read it out. Hello, doctor. What food should I avoid with lupus or my medication? Okay. I think I'll just answer that question. There is no
Mm.
specific diet which will reduce the lupus, or there is no diet that is specific for your medications. But remember, all the doctors will look at your medications, serum creatinine, potassium, protein loss, everything put together, and they will try to specifically tell you how much of protein, how much of salt, how much of potassium. All these things can be taken, and also the fluid restriction. But is there one size fitting all? The answer is no. And as I told you, especially lupus, it is a great mimicker. It's going to behave in a very erratic fashion. So, uh, one type of diet is not going to fit everybody.
Thank you, ma'am. The other one is asking
Question
how
is
can I prevent flares?
prevent the flares. Okay, I'll answer that question. See, this lupus, as I told you again, it is known for its very tumultuous course. That is, it can vary from good response to flares wherein it has come back again. Sometimes these flares are mild, sometimes they are really bad. Taking the medications regularly and following up without missing any doses probably will prevent flares, but it is not a foolproof. Even small infections can sometimes flare it up. Pregnancy can flare it up. There is no specific thing in which I can assure you that the flares will not come back again. Especially this lupus is known for its ups and downs in its course. Hope I have answered
Okay,
that
thank
question
yes,
well.
yes, yes. Yes, thank you so much, ma'am. Thank you for your time. It was such a great
Welcome.
session, and our subscriber are like really happy with this session. Thank you so much, ma'am. Let's wait for a while. Naveen sir is about to join us in a moment. Just give us a time, ma'am.
Okay.
Hello, doctor. I think I just got logged out.
Oh, okay.
So we'll
No,
just
meanwhile,
quickly.
I just answered the questions that was there on the comment box.
Okay, 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 okay. Great. Have you answered them all, doctor?
There were two. Are there more?
No, I think one was how can we prevent flares, and what are the kind of food options that one can take
Correct.
to avoid. I think you've answered them both. Just last before we leave, what's
Hmm.
what's life after lupus? What's life after lupus? What's life after lupus nephritis diagnosis? Or if we did not touch upon kidney and transplant because there are a lot of things that we can talk about, and we wanted to keep it
Correct.
very basic for this time. But what is life? What is the prognosis, and what can one expect, doctor? One last question.
Okay, sure. That's a very important question. As I told you, just like diabetes and hypertension, lupus is going to be there for the lifetime. So it can be kept under control, but it doesn't go away completely. So follow up is very important. Immunosuppressive medications, the ups and downs, what the doctors will advise is also very important. You'll have to constantly follow up and look out for ups and downs like flares and remissions and other things. And uh, sometimes we have seen some lucky people who will live with lupus for many, many years if it has gone into a remission. If it does not, then it can take a very bad course. And as I told you, it can take away one of the organs, and it's very difficult. Then, uh, like how you have told me about your lupus and transplant is a good option. And remember, lupus can again come back into the transplant kidney, though you're on immunosuppressive medications and under the doctor's monitor, so the chances are less. It is picked up early and can be treated early too.
Thank you so much, doctor. I think there's one question: how to prevent lupus? You can't prevent lupus, as doctor said. People can go on remission. You can't, reverse it as well. But please take your medicines on time. I've come across many patients, like especially the men, not taking medicines on time, and their lupus has come back, and a lot of things have happened. So you can't prevent it, but yeah, you can stay healthy and have a better life with lupus. With that, we'll finish today's masterclass about lupus. Thank you so much, Dr. Anitha, for being so patient. We have just overshot the
Welcome.
time, but thank you so much. It was lovely talking to you. I hope a lot of people will be benefited with this masterclass, and we hope to see you again in this masterclass. Thank you so much, Kidney Warriors Foundation. Thank you so much, Vasu ma'am, for coming up with this concept. Have a good day, everyone. Thank you so much, doctor. Have a good day.
Thank you.